Hello, my name is Brett Such. I'm a nurse case manager with Blue Care Connect at Blue Cross Blue Shield of Michigan. And I've been asked to come here to talk to you a little bit about hospice care. And hospice care is the next level of care for most of our members. And a lot of our members at Blue Cross Blue Shield, the ones that we're managing in case management, are advanced in years. They're the Medicare population, and they're also very complex individuals. And what this means is that some of their conditions are not going to improve. And so it's sometimes our job to help advance them to that next level of care and to educate them about what that is and why it may or may not be a good idea. So the first thing I'd like to do is introduce myself. You all know me as a case manager here. And my background, though, before this was home care, but especially it was in hospice care with Hospice of Michigan. It's a major, one of the largest hospice providers in the United States. It's also a not-for-profit here in Michigan and the largest in Michigan. So I spent about a year and a half providing hospice care as a case manager with them. And what that meant is I went into the home and helped these individuals through their hospice process. Hospice care is a very unique and difficult career path for a nurse. It requires a very special kind of person in calling. I'm not necessarily saying I am a special kind of person, but a lot of the people I worked with were some of the most dedicated individuals that went through some of the most difficult nursing times and very stressful ordeals. So hospice care, as you know, is something that means we will back away from, and our members are not really eligible for case management after this. So this actually helps us out in the Blue Care Connect program where people stay on for an indefinite period of time. So this will help reduce our caseload and get our patients the best level of care that they deserve. So first off, we talk about hospice and we say, what is it? It's the H word. There are a lot of myths and bad thoughts about what hospice is. Some people don't even want to say the word. Some people feel like this means death. This is the end. And I really want to dispel those myths. Hospice is not the end. It is not people coming in and just ushering it in. Hospice, one of their goals is to in no way hasten or prolong death. So they're not actually ushering in the end. They are not trying to prolong it either. So let's look a little bit about what hospice actually is. So what is it? Hospice is a holistic approach to comfort care in the terminal patient. It combines multiple disciplines in its approach to patient care and attempts to deliver dignified end-of-life care to patients in their own homes. All right, so that's a nice thing. What does that mean? It means it's bringing people, experts, into the home. That includes doctors, nurses, social workers, nursing aides to help out with care and help them do what they cannot. So a lot of what we're doing is they can't get out of the home anymore very easily. It's taking away their quality of life to have to go to the doctors. So we bring the doctors to them. They need advice and education there in the home. So we provide that. And a lot of what we do is working with the family. And we provide education so that they feel more comfortable with what's going on, more comfortable with what to expect next. Sometimes that's the most difficult thing for families, is not just dealing with what's going on, but the fear of what they don't know. And you don't know what's going to happen, and it increases your anxiety, and it increases your stress in a very stressful time, and it takes away from the experience of spending those last moments with a loved one. So that's something hospice can help do, is remove that stress and just let those feelings, emotions, this experience come out. So who's eligible for this? As a Medicare program, hospice has a lot of eligibility requirements. The most basic guideline is that given the natural progression of a patient's illness, it's reasonable to assume they have 6 months or less to live. They actually will require a doctor to say this. But they have guidelines that are based on other diseases, very specific processes. For instance, with a heart failure diagnosis, you would need a person to have an ejection fraction, which is a definition of how well the heart's working. Anything above 50% is normal. So you would need that person to have 20% or less ejection fraction. That's a technical term for those that are watching that are not nurses or in the medical field. So that's just one example of how that of how you would determine eligibility with someone for hospice. So what does hospice offer? We talked before about doctors and nurses and nursing aides. It also offers social workers, spiritual care, grief support for the family members, and all of these professionals meet where they are. They also provide what they call a comfort kit, which is emergency medications to do whatever it takes to make the patient comfortable and home without having to call 911. They actually provide a 24-hour nursing line where someone can call and either receive advice or education over the phone or dispatch one of the on-call nurses to the house. But let's circle back to what I said, is that these professionals meet the patient where they are. What does that mean? It refers to a patient's home, nursing home, assisted living facility, sometimes a hospital. Once in hospice in Michigan, care was delivered to a homeless man. Yes, really, a homeless man. He lived on the street, and while hospice staff urged him and assisted him to find adequate placement or housing, they delivered the needed care and medications to him, no matter what his location. It's a pretty good example from where I stand of hospice's dedication to the patient and to taking care of them and making sure they have everything they need, no matter their circumstances. So why hospice? It's a covered Medicare benefit. Most people are eligible for it. Few services actually provide any of this similar care. There are a couple that come close. Most of them are not widely accepted by most private insurances or Medicare. So this is a pretty unique program in that most of these services are covered, medications are paid for and sent to the home, supplies are paid for, and of course the care coming into the home. So hospice staff are there because they're called to do this. Like I said, it's a very difficult job. In most cases, it pays a lot less than most other nursing professions. And so I always recommend anyone who's eligible for this benefit should utilize it. It's something they can revoke at any time, so there's no choosing this benefit does not mean you can't go to the doctor anymore. It doesn't mean you can't go to the hospital anymore. It doesn't mean you can't have a surgery or a cancer treatment or change your mind and want to go back on a certain medication. It just means you've chosen a path, and they're going to back you up and stand behind you on that path. And then if you change your mind, you do. There's no penalty for that. So that's my presentation on hospice, and I hope it helps you guys out. I hope you have a better understanding about what hospice is and can better utilize it for your patients. Thank you very much for listening. It's been a real pleasure talking with you today, and I hope I'll be seeing you all again soon. Have a wonderful day.